We're in unprecedented times right now. I had said to one of my colleagues a moment ago, who would have thought that we would be standing here today talking about a pandemic similar to one that occurred over 100 years ago in this country. Memorial Healthcare System is, I believe, the premier healthcare system in South Florida. And we are going to be open for business, really starting today. We are preparing, and as you can see behind me and in this great hall, which is a conference hall, we have set up essentially a pre-admission testing facility so that patients who come in and need invasive procedures, surgery, and the like can get all of their testing outside of the four walls of the hospital. But I think the most important message that I can bring about today to you all and to our community is that hospitals are safe. This hospital and our healthcare system's hospitals are certainly safe. Our COVID-19 patients, and we've had a fair number of COVID-19 patients, both in our regular units and in our intensive care units, are separated from the general patient population that are in our healthcare system, and they will remain separated. Those people who treat the COVID-19 patients are not the same people who are going to be treating and caring for the elective patients or urgent patients who otherwise might come into our healthcare system. We have the ability in every one of our hospitals to provide this level of pre-admission testing and this level of keeping the infectious patients, the COVID-19 patients, totally separated from any other patients that we deal with. I think it's going to be important also as my colleagues behind me begin to speak about the other kinds of diseases that we care for here at Memorial, that those diseases haven't gone away. This is Stroke Month. Dr. Brijesh Mehta is going to talk about neurological disease and stroke and the fact that this disease is not protective against strokes or heart attacks or cancer or any other diseases that befall us as a society. It's critically important that patients understand if they have symptoms of heart disease or stroke or other maladies that may befall them, and they need to see a physician or they need to come to the hospital, they need to do so. It is critically important that they not put off serious illness. There are some statistics now coming out of other states that have shown increased mortality related to heart disease and severe neurological disease and cancer, which if not taken care of, only get worse. And in some instances, people have succumbed to these other illnesses. So I'm going to turn it back to Kurting to introduce the next speaker. And obviously I'll be here along with the rest of the crew here to answer any questions that you have at the end of the program. And thank you all for being here today. And a special thanks to our EMS colleagues who are here really representing all of EMS throughout South Broward. Thank you.